Healthcare system in Japan. Japan was the first nation in Asia to create a comprehensive social insurance program. Insurers are all not-for-profit and do not compete. They all cover the same services and drugs for the same price. All citizens are required to have health insurance, either through an employer-based health insurance program or through the National Healthcare Program. Those who can't afford the premiums receive public assistance. The Japanese Health Ministry tightly controls these fixed prices and negotiates rates every 2 years with the healthcare industry. Patients have access to all health institutions, so they often skip a visit to the general practitioner according to the World Health Organization. Most doctors and almost all hospitals are in the private sector, so patients are free to choose their providers. Covered services under Japan's system include in and out patient care, home care, dental prescriptions, long-term care, home nursing for the elderly, and prosthetics. Cash benefits are given for childbirth. Costs that are not covered include routine physical exams, some dental services, and over-the-counter drugs. The cost of premiums for participants in employer health insurance in Japan are shared by the employer and the employee, and the average contribution by employees is around 4% of a person's salary. The employees also pay between 20 and 30% of care costs, up to a level, after which they receive full coverage. National health insurance participants pay co-payments for care and prescription drugs, and a premium determined by salary. Participants in the program also share 30% of costs until a certain price point, after which they receive full coverage. Government expenditures account for just over 81% of total health spending. In conclusion, Japan's socialized healthcare system stands out as one of the best performing countries when it comes to healthcare. Not only does it have universal coverage, but it has excellent health status, and at a very low cost. There is a high degree of satisfaction amongst the population, and Japan has kept costs low through negotiations between the government and providers. However, Japan has fewer primary care doctors, driving some people straight to specialized or emergency services.